Cancer. It's a word that carries so much weight, doesn't it? But understanding it, well, that's the first step to taking away some of its power. So today, we're going to break down what cancer really is, what we can do to reduce our risk, and how doctors figure it all out.
So let's just dive right in with the big one. What actually is cancer? What's going on inside the body?
Okay, so at its most basic level, cancer is all about cells that have forgotten how to stop growing. Think about it like this. Imagine every healthy cell in your body is like a photocopier with a built-in stop button. It makes a copy when it needs to, and then it stops. Simple. But with cancer, that stop button is broken. The copier just gets stuck in the on position, churning out more and more abnormal copies without any control.
And these rogue cells, they're pretty resourceful. As they keep multiplying, they could start to clump together and form tumors. But here's the really wild part. They can actually trick the body into building them their own blood vessels. It's like they're building their own highways and supply lines to get the fuel they need to keep on growing.
And that brings us to a really important word, metastasis. If the blood and lymph systems are the body's highways, metastasis is when those cancer cells break off, hop on the freeway, and travel to set up a new camp in a totally different part of the body. And here's something you got to remember. No matter where that cancer goes, it's always named after the place it started.
Okay, so this is something that trips a lot of people up. The difference between a benign tumor and a malignant one. Benign tumors are kind of like well-behaved neighbors. They might grow slowly, and their cells pretty much look like the tissue around them. But crucially, they stay put. Malignant tumors, that's cancer, are the total opposite. They can grow fast, their cells look weird and different, and, this is the big one, they have that ability to invade other tissues and spread.
All right, so we've kind of laid out what we're dealing with. But now, let's talk about the part where we have some control. Let's shift gears to the really empowering stuff, the proactive steps we can all take for our health.
First up, let's talk about the stuff we do every single day, because the science is super clear that our lifestyle choices make a huge difference. Keeping a healthy weight and getting regular exercise, that's the foundation. And of course, what we eat is key. We're talking more fruits, veggies, and lean protein, and less of the processed red meats and sugar. And look, it almost goes without saying, but avoiding tobacco completely and limiting alcohol, those are absolute game changers for reducing risk.
But it's not just about what you eat or how much you move. Prevention also means being smart about your environment, like protecting your skin from the sun. And there are some really powerful medical steps we can take too. Getting vaccinated for viruses like HPV and hepatitis B can prevent cancers they're linked to. Even things like keeping an eye on moles, or for new moms, breastfeeding. It all adds up.
All right, let's talk about warning signs. And I want to be super clear about this. Seeing one of these signs is not a reason to panic. Think of them more like clues, signals from your body telling you that it might be a good time to just check in with your doctor.
You see the pattern here, right? It's all about change. Things that are new or different and just stick around. Unexplained weight loss, a new lump, a sore that just won't heal, a cough that doesn't go away. Your body has its own normal rhythm, and these are basically signals that something might be a little out of sync. So let's say you do notice something and you go to the doctor. What happens next? Well, it's not a big mystery. It's actually a really logical, step-by-step investigation that doctors use to get to the bottom of things and find clear answers.
So the whole thing usually follows a pretty clear path. It's going to start with a physical exam and your doctor asking a ton of questions about your health history. From there, they might move on to lab tests or imaging scans, gathering more and more pieces of the puzzle before they get to what's often the most definitive step, a biopsy. So lab tests, like blood work, can give doctors some huge clues about what's going on with your organ function or your blood counts. And then you've got imaging, things like CT scans and MRIs. These are basically the body's surveillance cameras. They let doctors see if there's a tumor, how big it is, and if it looks like it's spread anywhere else.
But really, the absolute gold standard, the thing that gives a definitive yes or no, is almost always a biopsy. That just means taking a tiny little sample of the tissue so a specialist can look at it under a microscope. And there are a bunch of ways to do it, from just shaving a bit of skin, to using a needle to draw out some tissue, to a small surgery to remove a piece of a tumor.
Okay, let's dive into this next part, because if a diagnosis does come back, you're going to hear two words thrown around a lot: grading and staging. They can sound kind of technical and confusing, but they're just answering two very different, very important questions. First up, you've got grading. All grading does is answer the question, how weird do these cancer cells look compared to healthy cells? It's usually on a scale, like G1 to G4.
A low grade, like G1, means the cells are well differentiated. Basically, they still look a lot like normal cells, which, is generally what you want to see.
And then there's staging. So if grading is about what the cells look like, staging is all about where they are. It answers the question, how far has this thing spread? The system doctors use most is called TNM. It measures the size of the original tumor, whether it's gotten into any lymph nodes, and if it is metastasized or spread to other parts of the body. Staging is the map.
So let's put that all together with an example so it makes sense. If someone has a stage of T4 and 3 M1, that paints a really clear picture for the doctors. It tells them, T4, we're dealing with a large tumor. And 3, it has spread quite a bit to the lymph nodes. And M1, yes, it has metastasized to another part of the body. Having this exact address is absolutely crucial for figuring out the best possible treatment plan.
Wow, okay, we have covered a ton of ground here, from the biology of a single cell all the way to a complex diagnosis. But information is only really powerful if we do something with it, right? So I want to leave you with this one question to think about. Based on everything we just talked about, what's one small, totally manageable step you can take for your health today?